It may vary from country to country, though generally they would prefer to have someone in perfect shape. You will have to check up with the forces in your country. The reason is that any failure of your system is not acceptable in a setting like the Air Force. It may also depend on the available human resources in your country. It might be worth noting that most heart murmurs are innocent and not associated with significant heart disease and is suitable for a normal civilian life. But the stresses to the cardiovascular system in army are quite different than in civilian life. Any significant heart problem is certainly to be excluded by appropriate investigations like an echocardiogram, even in civilian life.